Hello and welcome to this year's World AIDS Day Roundtable discussion hosted by Trade Sexual Health. My name is Brad Foster and I'm one of the volunteers here at Trade working on this year's AIDS Day events. Every year on the 1st of December, people from across the world come together in the fight against HIV to stand in solidarity with those living with HIV, as well as remembering those who have lost their lives to HIV and AIDS. Now, due to current coronavirus restrictions, this year's events are taking place online. So I'm grateful to our panel for joining us virtually for today's event. If you want to follow today's discussion online or take part in other World AIDS Day events, you can follow Trade Sexual Health on Facebook, Twitter, or Instagram, or use the hashtag Leicester WAD 2020. That's Leicester WAD 2020. Now, without further ado, I'd like to introduce our panel for today.
Hello, I'm Donna Rees. I'm a nurse in the National Health Service and I work in Leicester. I've been doing this since 1991. My main role is working with new diagnosis, so supporting them, giving them their results, investigations and advice and ongoing help as part of a team. But a really key part of my role is partner notification. And just so I can let you know how that impacts on HIV detection, Public Health England said that in 2018, there were 1,467 contacts tested and 57 of those were positive. So that's a positive rate of 3.9%. Whereas when people are going through clinic, the normal pickup rate of HIV is 0.2%. So there's a 24-fold increase in picking up HIV when we're testing their contacts. So obviously, I think it's a really important role. We do that by provider referral, by trying to protect the index patient's confidentiality. And that obviously with HIV and, it's a complex condition, it's a really important part of what I do.
And Juliet?
Hello, my name is Juliet Kisob, and I work on the health promotion team at Leicester Sexual Health, which is part of Midlands Partnership Foundation NHS Trust. Our task is mainly on information awareness and testing. And what we do is going out into the diverse population of Leicester, giving the information, working with groups and community organizations that are already working within the community. And part of that is through leaflets, through posters, but we also put a lot of information on the website for people to access, including information about testing. Just making sure that everyone has access to information that can enable them test wherever they are able to at their comfort and still have their results. So we are a team, but my work is mainly within Leicester City.
My name is Makinder Chahal, and I'm the Senior Health Promotion Worker at Trade Sexual Health. We're a sexual health and HIV prevention charity working across Leicester, Leicestershire and Rutland. Primarily, we work with lesbian, gay, bisexual and transgender communities with a HIV prevention focus on gay and bisexual men and other men having sex with men. But also we've started some new work on supporting new arrivals with sexual health and HIV prevention.
Hi, I'm Ken Coney. I'm a trustee of Trade. For my work, I'm actually a consultant to the pharmaceutical industry. I tend to work mostly in the regulatory affairs area, particularly with labelling, and my particular expertise is HIV and respiratory medicines.
Amazing, thank you. So I'd like to start by talking about World AIDS Day in the year that is 2020 and everything that's gone on. Has World AIDS Day this year taken on a different meaning given the current coronavirus pandemic? Perhaps, Donna, if we start with you as someone who works in the NHS, how has this affected the work you do?
Well, like everything else, a lot of the work I've had to do has been over the telephone, or through email or texting, with communicating with patients rather than face to face when it doesn't need to be, and only trying to bring patients into clinic, obviously, when needs must. But from the point of view of how the pandemic's affecting World AIDS Day, I think one of the primary things about World AIDS Day and its history is opportunity for people to actually meet and get together. And I think that's probably one of the saddest things about this year's. But obviously, you know, we need to overcome that in the safest way possible, because there's no need for people to experience that day on their own. I think it's important that people start to plan now and to reach out, because it can be a very sad day remembering the people we've lost, and HIV itself is isolating enough, and I think that's mirrored by the pandemic and everything that's gone on this year.
And Juliet, is that an experience you share as someone, again, who works in sexual health? I know there's been reports of sort of a massive uptake in home testing kits because people aren't going into clinics in the same way. Have you seen a change this year, and sort of what has this year changed for World AIDS Day for you?
Yeah, I think again, one misses the contacts, just going out there and chatting with people, being available for people to ask questions, to explain things, to put up things for people to see. With the situation of COVID or post COVID and post COVID, going into the community has not been possible, which means that a lot of information and promotion is online, which again makes it difficult for some of the communities or individuals who are not able to access different social media, or who are not able to afford that for that purpose. But still, there is the collaborative working, as I'm saying, through multi-agency platforms where one has the chance to be able to share some information, and the organizations that are involved, they take it to their own various forums or networks. So hopefully people are accessing through that. For the community groups, it's been tough because it's not been possible to actually go out, like I said. But we have those, like there is a community group called the ADP, African Development Project, who have some links within the community, and they are still able to chat with people on the phone. But in terms of what COVID-19 has done, apart from not having that opportunity to go out doing testing, the campaign and testing, taking testing to the people as before, which has not been possible at all. But there is a message of hope, in the sense that the world of HIV suddenly finds itself like a big sister or big brother kind of image, looking after a sibling through lessons, sharing lessons of hope, of experiences where I have been, and these are the things that I learned from where I've been, which I am sharing, which will help the present situation. So the world of HIV suddenly finds itself in that kind of a situation, bringing message of hope, not just for limiting it to the HIV per se, but broadening it now to another similar kind of situation.
Makinder, are those thoughts that you would echo in those comparisons, or sort of similarities in the response, and what we can do as a collective to sort of get through this current situation we find ourselves in, looking at lessons from the past and our response to the HIV?
Yeah, no, definitely. And I think I want to echo what Donna and Juliet have said about that, the physical in-person element of World AIDS Day, which is an important reminder, not just for those people living with HIV, but also as an opportunity to fight and challenge that stigma and stand up for the rights of HIV positive people, which often just get forgotten about. And actually the stigma and discrimination still faced by people living with HIV is substantial. And, by having that support network physically around you just for one day a year is important to show that solidarity with people living with HIV, but also to continue fighting that stigma. And it is a shame that activities can't happen in person. And we know that online activity isn't the most ideal for everybody. I think one thing that, especially with the coronavirus pandemic, it has highlighted is, access to online or smartphone, and, really highlighted digital poverty within a lot of communities. And actually, when it comes to the work that we do, it has sometimes been a barrier for those people wanting to access either testing services or even support services, especially when we talk about individuals which may come from different communities where there still is a very high stigma of sex or sexual health or even HIV. And with the majority of the work that we do at Trades are working with men who have sex with men, with a lot of those men actually identifying as heterosexual and maybe being in heterosexual marriages, access to testing has become even harder, as where we would go into the community to be able to deliver that, and we would go to the locations where they would be. Now those locations have gone or they've been closed, and actually it's created then a barrier for those communities to be able to access the support and services which they had done in the past. And would they access online services? More than likely not, because actually it takes away the element of the community work, as Juliet has touched upon as well, about us going into the community to be able to deliver that and taking the services to where they're really needed, as opposed to turning the model around now to getting people to go to the services. And I think it could be counterproductive going forward, but I think it's definitely like a new era of learning in comparison to like when the HIV epidemic first started. Now we've got the joys of technology, but actually the joys could also come as a burden for some people too. So it's about finding that balance between doing the best thing for everybody, but also still providing that essential support and services for people who need it the most.
Mm. And I know there was a report in the summer, I think with Dean Street, that was saying in the first UK lockdown, 84% of people were abstaining from sex outside of their immediate household, and this change in behaviour gave the chance to break the chain on HIV transmission, and there was a big drive for testing. I mean, we find ourselves in another lockdown now, and we sort of don't know what the future's going to hold. How important and how vital then is getting testing out and adapting to the ever-changing situation we find ourselves in, because that's quite a unique set of circumstances where you have such a change in behaviour.
I think it definitely presents an opportunity to be able to, like you said, break that chain. And actually, if people are either abstaining from having sex, being able to get an accurate HIV or STI result during the time of the lockdown, I think has been a crucial time. But it's also to understand that not everybody would have the opportunity to abstain from sex during that time for a whole variety of different reasons. If we talk about sex workers, for example, where sex is part of their work, and actually to take that away, but still being as part of what would be considered a higher risk community of HIV and STI acquisition, then actually it's difficult to be able to target that blanketly across all populations. But actually, sometimes the accessibility with services being closed or specific specialist outreach services not being available.
Our experience, we've had, at least to my knowledge, 14 or 15 new diagnoses since March. And we've certainly, because obviously routinely screening all of our HIV patients for STIs, we've seen a significant number of infections like chlamydia, gonorrhea and syphilis. So, obviously a lot of people are still enjoying a sex life, and perhaps they don't always want to admit to in the pandemic, what they're actually doing, because they're not meant to be. So I think there is still a lot of infection out there, and perhaps we'll only really know how much of that when people can freely walk into clinics again. But I think it's important that we do make the point that people still can access testing. I think that's really important, because a lot of people do around the time of World AIDS Day do think, oh, I will actually test, let's do it. and that's still available. So to contact the sexual health services or trade, you know, forever, tests are available.
Yeah, I do agree with Donna. We need to keep the word going, making people aware that it is still around, and that there are tests, the various types of tests that are available online, like we said, to the clinics. They can always call. There is always someone who can answer a call at trade. There's always someone who there is in. I've noticed, like with HPA, HIV Prevention England website. So some of the websites, they have the links to all the providers, in the various parts of the country. So we can't stop talking about it. We have to continue raising awareness. We have to continue signposting people. We have to continue hoping that the message is reaching the different platforms. Wherever we are and where there is that opportunity, whether virtually, wherever we are, we still need to find a way to make National Testing Week work to an extent by sharing this message. I see it as good news. The fact that the test is available, the fact that people can get tested, know their status in a confidential way, and people can get the right support, the right treatment, and live well with the treatment. That is fantastic news that we cannot keep under the cupboard or in the cupboard locked up somewhere. We have to keep
Juliet.
sharing that message.
Absolutely.
Yeah.
And I think we should try also, I think possibly as our contribution to a digital World AIDS Day, to push this message. I think one thing that was saddened me this year was that we lost Pride, obviously, because that's a place where so many people can go and be tested without anybody else knowing. It's a sort of, it's a safe environment. They can just sneak into the back of a tent, be tested, and become part of the system where they are actually be able to be traced. Now, we lost that this year. So I think one of the best things we could do as part of World AIDS Day is to actually push the fact that testing is still available and can be done anonymously. It's not quite as easy as sort of sneaking into the back of a tent on Pride Day, but it's got, you know, it's discreet. Nobody needs to know. Your wife doesn't need to know. You know, your colleagues don't need to know. You can still be tested. I think that's a really important thing, that we can actually make a benefit out of the fact that we've got this situation where we can't meet and talk together.
And Ken, I wonder, just sort of thinking about this year and what's happened with the coronavirus pandemic, as someone who has a background in pharmaceuticals, you know, everything in the news at the minute is this race towards COVID vaccine. And I just wonder what your thoughts are in terms of the developments medically, in terms of the fight against HIV, you know, in this current context of this absolute race for a COVID vaccine.
I was going to say, first and foremost, I think it's absolutely astounding. The race has turned out that it's looking like, you know, pretty much we're going to have a series of vaccines, which is absolutely important, because there's one vaccine is never enough. I think it's very, very heartening, but I think the message that we have to sort of make sure that people understand is they go, well, how can we get a vaccine in less than a year? In fact, we get multiple vaccines in less than a year for coronavirus. And we've been looking for a vaccine for HIV for 35 years. And that's just basically down to biology. You know, the HIV virus is a sneaky little devil, and it's almost impossible to actually use the normal techniques to find a vaccine to do it. Coronavirus is it's an easier target. It's not an easy target, but it's an easier target. And also there is a world of difference between the resources that have been put into it, because for years there's been groups trying to get an HIV vaccine. I think the foot came off the pedal when we actually started to get and really seriously good antiretrovirals, because it became a condition that people could live with, and it became a relatively easy disease to live with should you take the medicines every day, and et cetera, et cetera. So I think the foot came off the gas on that one. And also there was never, ever the sort of the level of investment in time, effort and money that we've seen with coronavirus. And to an extent, that's actually understandable, because coronavirus potentially can, you know, you can breathe on somebody and they become infected, and that's everybody in the world is potentially at risk. There's a perception that HIV, you have to be doing specific activities to be at risk. And that's never been sort of quite, you know, sort of, that's never going to happen to me. You know, that's not actually the case. But, you know, I think there's a different perception globally, and sort of the level of resources that have been thrown at coronavirus. It's no surprise that we've actually done this. There's also been so much effort, you know, all the pharmaceutical companies, all the universities, that's all they're doing at the present moment. There's an awful lot of other research that would normally be done for other diseases that's just on the back burner and being ignored, because everybody, this is all that they're caring about. So it's a case, but it is something that I think we need to sort of, when we're talking to people that in our communities that run the risk, who, well, why haven't we got a vaccine? If they can get a vaccine in weeks, it's comparing apples and pears, that they are two different things. Coronavirus is a relatively easy one to get at, whereas HIV, I don't think we'll ever get there. I really don't. I think it's an impossible target. However, what we did get were very effective medicines that actually can stop people getting infected in the first place, and those who are actually infected can lead an absolutely normal life with no impact. I mean, if you ask any doctor today, would they rather have diabetes or HIV? They would all pump for HIV, because it's a much easier condition to live with, you know, on a day-to-day condition. But unfortunately, the stigma and the perception of the general public completely different from the actuality of it.
And I think we might jump back to sort of treatments a bit later on. There's just one thing I just wanted to touch on before we move on, and that sort of picks up on the point of this, the resources being thrown into COVID, and the sort of race for a vaccine is touching on the theme of one of the themes of World AIDS Day this year, which is global solidarity, shared responsibility. And there was a report by the UN that said that there was $1.3 billion less in responses available to middle and low income countries for AIDS in 2019 than there was in 2017. And recent modelling has estimated that a 6-month disruption in HIV treatment due to COVID-19 could lead to more than 500,000 additional deaths from AIDS-related illnesses. And I just wanted to open it up how important it is on World AIDS Day to think globally, and whilst we sort of rush towards a response to COVID-19, that we don't let our foot off the gas when it comes to HIV.
I think when it comes to World AIDS Day, like the clues in the title of it, it's World AIDS Day. It's a global response, and actually, although within the UK, with the UN AIDS 1990 targets, the UK is exceeding those, or meeting those targets. When you look at the global picture, as you rightly said, Brad, like those figures aren't representative, and we're fortunate being in the UK that it's relatively easy to access testing, very easy to access treatment and ongoing support. But there are other areas of the world where even accessing a HIV test is still a struggle. And even when they're in like very high prevalence countries where actually that support is not there, it's about how we need to take a step back and reflect upon the great things that we have got in the UK, but also what can we do to then support other individuals and other countries across the world with the global response. And actually, as we've seen with coronavirus, like you rightly said, there's been so much resource poured into it, but actually now would be the time to kind of like step back, reflect, and reach out to other people who may be struggling, and actually see how we can come together in solidarity to really end new HIV transmission on a global basis.
Yeah, absolutely.
Can I just go back to something that I think Ken and Makinder have touched on? That something I was looking at and think we've realised in our service is that since the pandemic, a number of people who hadn't been engaging with the service, so they'd previously been diagnosed, but then since the pandemic, they've suddenly become more health aware, I think, and especially with the effect of COVID on the BAME population. And obviously a large proportion of our patients being African, suddenly become more health aware and started to re-engage with the service, which obviously is a real plus. It made me look at some of the figures. So the UK stats, I think these were for 2019, said that there was about 104,000 people at that time in the UK diagnosed with HIV, but nearly 2,000 of those people still weren't engaging with services. And then out of the people that are engaging, 15% of them still have a significant viral load, which obviously affects their health and means onward transmission of the virus. Obviously, we're in a very privileged situation where we've got all this healthcare, we've got all this medication, we've got all this testing, and we still can't get it right for people because of the stigma. So how is, like, you know, the poorer countries of the world going to cope? You know, where I think I've read some figures that 1 in 25 Africans are HIV positive in some areas, you know, and they can't even access tests, medication, etc. So there's so much inequality. I can't even comprehend it on that sort of scale, to be honest.
And sort of, you know, in that UN report, sort of how other countries are pulling back on their response and resources to low and middle income countries, and like you say, it seems incomprehensible, really, that especially at this time with all the obstacles that are already there, you then add in sort of access to healthcare from medicines getting into countries because of lockdowns and transport links being Juliet, how important is it in this sort of global response to HIV?
I think one thing that came from the world of HIV is a solidarity as the world has never known before. And this solidarity is from individuals, communities, and institutions who believed in joining hands together to fight against a common evil. And for me, these are the individuals who value creation to the extent where they are able to take a step further to doing something about it. And that for me remains a core thing that we can hold on to, in the sense that in the heart of all of it has been care and compassion, isn't it? For people who cared enough from the start. I'm thinking at the start where people were left on their own, but there were those people who cared enough to say, we will stand by. And they stood by from the start and have continued to stand by till today. What the difficulty that has come up with COVID is the fact that a lot of places around the world that previously, like we just mentioned, previously benefited from some access. But even though having the access to treatment and medication and testing had its own challenges. I'm thinking of a situation where people lived in a rural area. I am thinking from a background that I know. You live in a rural area which is completely cut off from social amenities, road networks, and so on, which is costly to get to hospital, even for the normal routine checks. Now, it becomes even more difficult when that is not even possible, because many of some of these places are struggling even to tackle the realities of COVID itself. It makes me worry about what is happening to the people who are living with HIV, to the people who are currently receiving treatment, who are not even able to, there is no access to posting stuff like we have here. But it also makes me see how blessed we are to have those things. But are we going to be complacent because we've had it or because we have access to it and forget about the others? We must keep talking. The voice is really powerful. We must keep talking. But the other thing that I noticed with the COVID situation is that there are more people. I don't know. When I chat with people, and I draw from the HIV experience, I see more people willing to listen. Because the difficulty before was, forgive me if I keep on drawing to some of these images. So when you cook, invite guests and no one turns up. Suddenly you cook, you invite, and people are willing to turn up. Even though the excuse is but for COVID, which means there is that willingness to listen. Yeah. And I'm hoping that that willingness to listen will translate into taking action, from listening into actually going forward to test.
Yeah, I think that's something Donna mentioned earlier, is this sort of renewed focus on healthcare or sort of people's own health. With what's going on with COVID, people are taking that step to maybe engage where they previously haven't before. Just very quickly, I'd like to get your thoughts on sort of your early memories and experiences of HIV. Juliet, I know just now you sort of spoke about that global response when it first came about, and that solidarity that everyone had. I just wondered if you all wouldn't mind sharing your first experiences, whether that's personally or professionally.
Oh yeah, I mean, how can I forget the binaries of life or death? It's the world seemed to be in two boxes. So either you are alive because you didn't live with HIV, or you were condemned to death because you lived with HIV. That was a kind of binary. And that was part of how people responded to the tombstone images that came before, with good intention, but that was kind of how people responded to it. But moving forward, as we think about World AIDS Day, and as I always think about it, why with mixed feelings? Why mixed feelings? There is that deep gratitude for those who dared to stand up, who dared to stand by. For me, it was a costly choice. But with some regret and pain, it's for those who went for the easy option. And that's what we are talking about. The blame, the labeling, the not in my backyard attitude. What did that yield for anyone or for the world? Apart from fear, stigma, discrimination, and widening the gap of inequality. And that is what is still preventing some from coming forward to test.
And Donna, did it impact how you saw how your life went professionally? You know, were you working in the NHS?
Absolutely, yeah.
Or you know, drive you to take on that work?
Yeah, I was a student nurse in 1980, and I can remember in 1982 us all being called in for a special lecture where we were shown a film, and obviously it was American, and it was about basically young men who should have been young, healthy men who were dying, and they They were thin. They had like purpley blue bruises all over them, which I later learned was Kaposi's sarcoma, a cancer that you get with AIDS. They had torrential diarrhea. They had pneumonia. It was terrifying. And I can remember our tutor, Mrs. Hardwick, saying, this is going to be really important in your careers. This is new and it's coming from America, and you need to know about this. You need to be aware. And then, of course, it was really important for me because I sort of made my career out of sexual health. And so I've seen some incredible changes. And even when you started talking about your memories, I filled up. And World AIDS Day, I spent most of it crying, really. A lot of it with sadness, but some of it with joy that we've come so far now. I remember going to meetings which were held in secret with people with HIV, and them talking about how healthcare workers treated them, let alone the rest of the population. And we were meant to be informed. Living people, because they were known to have a diagnosis, being moved in an ambulance in a body bag, being in hospital and healthcare staff not coming near them. Because, like, if we were frightened, how was everybody else? So you can see how this all escalated and got out of control. You know, as Juliet said, with, you know, tombstones and icebergs and this blame culture and all this ignorance and fear. Remember, there was a great sense of solidarity between the staff and the patients. It was quite special, really. It really sort of gelled us all together. But of course, there was no benefits for people getting diagnosed. The only benefit really was to stop the onward spread of infection, because they knew and they could try not to share the infection. There wasn't really much in it for them. So they were so brave coming forward, and we lost so many people. It was tragic, absolutely tragic. Then obviously and then medication came in, and that was just incredible. And I can remember seeing people walking out of the clinic with 2 carrier bags full of medication, you know, and they had to take multiple doses. There were so many side effects, and sadly, a lot of people today still think that is the case. They really don't understand how manageable this condition is. And, you know, it is so easy now. Hard bit is getting your head around it and dealing with the stigma that we've created, you know, because it is so manageable. The tablets are so easily tolerated. It's so simple. You only have to attend the clinic a couple of times a year. You're well. You can have sex. You can have a healthy sex life. You can have relationships. You can have babies that are born negative. You know, and we've gone from at the beginning of my career in the sort of late 80s to where we are now, which isn't really a long period of time. Look how we've advanced.
Ken, I wonder what your experiences are from those early days as well.
I was going to say, I was a young gay man in London in 1980, so it was, having come from Glasgow, it was like sort of, you know, child in a candy store to begin with. And then you started hearing, you know, sort of these stories, and then it got worse and worse, and then you started to lose friends, and it was genuinely terrifying, and it completely changed your life, in your attitudes to what you could do, what, you know, you sort of felt that you particularly the media sort of portrayed you, you know, it was bad enough being gay, but sort of you were suddenly the absolute enemy and you were sort of the worst. What it did to me and sort of thing was that it actually made sure that I pushed my career, which, because I'd started in the pharmaceutical industry, and I actually actively made it my role to go and look for jobs. And I got working for Glaxo on the early development of the HIV drugs. It shaped my career. It was a reaction to it that sort of, you know, you were genuinely terrified all the time. It certainly sort of stopped me from ever having a relationship in the early 80s, because, you know, if you sort of spoke to anybody, you were going to die 5 minutes later. It was that sort of level of hysteria that even I bought into, because the media just pushed it. It was icebergs and tombstones all the time. And it had a very, very detrimental effect, I think, on a lot of people, particularly young gay men at the time. And when you were seeing people your own age that you knew dying, because that was something I'd never experienced, people my own age dying. And, it's still in my mind, I struggle with it. And it pushed me in a way, so like Donna said, my career became that because of a reaction towards it. And the immense amount of satisfaction when, a good 10 years or more later, when we started seeing medicines that actually worked, the antiretrovirals. I have a lot of pride that I was involved in I was a tiny little wheel in a cog in a very large wheel. My role was probably fairly unimportant, but it was very satisfying to have actually been part of, hopefully, a bit of the solution. And to sort of pick up on something else, I think the problem even today is that people still have that level of prejudice. They still think that it's, the 2 carrier bags full of pills. I mean, I knew so many people who spent their lives, with handfuls of pills, and they spent the last months of their lives on the toilet or being sick, because of it. It's no way to live. And that's still, when I was diagnosed with it, my family, their first thought was I was going to die. And this was like in the mid 2000s, where I sort of was, I was the happiest and least concerned of all the people, because I sort of went, oh, okay, I'll just take some tablets every day. That's got absolutely no impact. I spent more time emotionally counseling family members and friends who had all gone and bought the Rees, because it was like, oh shit, he's gone, and it's like, no, honestly, you've got me for a few years yet, it's not going to make any difference. It shows you that even though I was probably one of the most cautious people I know, I had worked in the industry all my life, still people can end up, being infected with it. It's a sneaky little thing that sort of gets to you, and even when you don't expect it to happen, it does, and you've spent your whole life trying not to let it happen. So no, I find World AIDS Day quite emotional, because I do know it makes you think of an awful lot of people that could have been could have been great friends of yours for your lifetime companions, and gone too soon.
It's really interesting, like how everybody's journey into kind of like HIV, like there's been a trigger there for people, and I think it's been the same for me as well. And I guess I'm of a different generation to everybody else in the room, but having not grown up, remembering anything. I mean, I was born in '88, so actually, it wasn't until much later that I'd even know or found out what HIV was, and that was until I was at university, in the late 2000s, and that was the first time I'd become aware of HIV and ever access, my first HIV test or STI screening. And as being part of the LGBT society at university, and engaging with the local sexual health team as part of the clinic, they approached us to start to deliver World AIDS Day activities and testing on campus and services with the local chapel. And this was all completely new to me. I was like, what is all this about? And actually, it wasn't until being exposed to that and actually, hearing about World AIDS Day and doing my own research that actually it really made me think, wow, I'm in a position now where I can do things and take action and not have to worry. But then at the same time, talking to other people about, their experiences of testing or what their perceived expectations were of testing, and actually how many people don't, but ultimately what could be but what the benefits are of it, I found were really powerful. And then once I started to get more involved with World AIDS Day at university over the 3-4 years I was at university, that then brought out the activist in me to think I have a responsibility of not just my generation to still make sure that we remember the past, learn and reflect, but also celebrate the progression. And I think it was from that point where I found my journey into HIV prevention in the voluntary sector. You know, I first got my first job out of university was working as a sexual health outreach worker for a charity in Derby. That was HIV prevention work. And then I've stayed within HIV prevention right until this day, and actually seeing the progression from before, but also seeing the new technology as well. You know, PEP was slowly starting to roll out in the 2000s. And then, you know, now we're living in the day and age of PrEP. The work is not done. There's so much work to be doing. And actually, you know, PrEP isn't just for, you know, people who are HIV negative, but it's also for HIV positive people to challenge the stigma and enabling them and empowering them to have the sex they want to have without fear, without shame, which still, unfortunately, a lot of people live with HIV still carry. And actually, you know, because they're so, even though, you know, being undetectable means you can't pass on HIV anymore, but actually sometimes it's difficult for individuals to be able to believe that. And if HIV positive people struggle to believe that, then actually how's the wider community also going to as well? So I know that my role within HIV prevention is still really important to still get those messages out there to challenge the stigma, but to also educate younger generations. Like as part of my work too, outside of COVID, we can go into schools, talk about relationships and sex ed. And when we have conversations about HIV, we're now talking about PrEP. You know, like if I, you know, talking about PrEP to 15, 16-year-olds is amazing, because I, you know, I can't ever think of a time when that conversation around HIV would have ever been had at that level or at that age. And so, you know, we have got the power to be able to do that, share this knowledge out more widely for then people to benefit from it going forward, even if it's not going to be personally for them, but it could be for somebody that they know and who they can support going forwards with challenging that stigma, with accessing testing, with accessing treatment. And actually everybody like them plays that part. And I think for me, that's when I realized, you know, the piece of the puzzle that I fit in as part of the drive for HIV. And actually, you know, taking PrEP myself has empowered not just me, but I can also talk about my personal experience as well of taking PrEP to people. So it's not just something that other people take. I can talk about me taking it. Let's have a conversation around HIV and testing, and also kind of like the sex positivity and empowerment of the, you know, having the best sex with the least harm to you.
And I wonder, Makinder, just listening to the rest of the panel's experience, something that I know we've talked about before is sort of sex education within schools, and sort of maybe how much of, especially first or early experiences around HIV were informed by stuff that had trickled down from the 80s. You know, Ken, you mentioned the media reporting and sort of like the really vitriolic tabloid press reporting around HIV at the time. You know, there's some very infamous quotes by some newspapers, and how much of that actually I didn't realize had affected what I had picked up along the way, sort of growing up in the 90s and noughties, when things had shifted in terms of a conversation. And Makinder, just thinking again about PrEP and the sort of sometimes perhaps stigma that comes with taking PrEP and access to PrEP. You know, how important is it that this conversation is changing, and that, you know, kids in school can talk freely about HIV and sexual health?
I mean, even when the news first caught light of PrEP, and, you know, there were certain conservative media outlets who then painted a picture of what PrEP was with specific communities, which I think has definitely kind of like not helped with the further stigmatization of, you know, HIV, but also, you know, further stigmatizing treatment or further stigmatizing prevention. But actually, you know, it's one of those things where I think in the day and age of like technology and access to lots of different types of media, you can be exposed to inaccurate information as well as accurate information, but knowing which one is the right one is fairly difficult to navigate in this digital world. And actually, you know, within the role that I do, it's about providing that the correct factual information. Likewise with Juliet and Donna, eradicating those stigmas, you know, and providing the accurate information to be like, this is how it is, and this is how it could benefit you. And I just feel it's a great privilege to be able to go into schools now. And even when I was at school, you know, Section 28 was still there. And I do feel that Section 28 had a massive impact and influence on getting that education out within schools. You know, associating HIV, especially with gay and bisexual men, and not being able to talk about homosexuality within the school context, I think would have had that detrimental effect. And I know when I was at school, like, you know, even talking about sex or alternative, like, different relationships was just never had. And I think, you know, we're slowly learning from that, but also living in a society now where we have lots of different things protecting people, the Equality Act protecting lots of different protected characteristics, and actually how we can then educate younger generations to then take that forward and use that to then challenge each other, but also to help each other learn and grow. And I think that's the one thing that we probably need to be focusing more on, is, you know, ensuring that we provide the tools for a younger generation to be able to learn from the past and use that as a foundation to then keep on growing and making sure that we're learning from the lessons of before.
I think that's so important, Makinder, because I think the whole key to all of this, what we're talking about, is education. I've given a diagnosis to a couple of people that I can think about who didn't even know what HIV was, and they were young people who'd gone through the British school system, born here, who you would think had access to all of this sex and relationship education, and they hadn't. They really didn't know what it was.
Yeah, I think alongside the message of PrEP, the message of you equals to you can also be empowering to both positive people and people who are living without HIV. So I think that adds on to what all the speakers have already said. Undetectable is equals to untransmittable, indicating that if a person with HIV is on meds and with consistently undetectable HIV viral load, then they cannot transmit the virus to someone else. I think it's also an empowering message that we can pass on and hold on to.
Can I just give you a quick anecdote about PrEP? Because I worked on it back in 2003, I think it was, when it was, and there were genuinely conversations that we had around the planning of it, where there was talk about whether or not it was worth doing, because it would be seen as a recreational party drug. And it's so close to not actually having been given the green light to be developed and all the studies put forward. And it was only because it wasn't, you know, I'm not going to take the credit for it. It was me and an awful lot of other people who were shouting very loudly that there was actually a serious need for it. And if it actually had worked, it was going to be a game changer for the whole world, and actually from a health perspective, because a relatively cheap drug preventing a very expensive set of drugs for people that are going to have to take it for 50 years or more, the cost benefit. And it was actually the argument of, if we spend a few thousand, you know, we've got a product, if we can save for a few $1,000s, we can save tens of millions or millions of dollars in health costs. And that still to this day shocks me that I was part of conversations where potentially hundreds of thousands of people's lives could have been lost because there was a perception that the right, and it was that this isn't going to play well in the Daily Mail.
And this has been the frustration of PrEP not being rolled out sooner. Like, it has been known to work, and actually, you know, the cost benefit is there. Like, but the thing is, like, it's taken so long, and the commissioning of it is slowly starting to come round, which is great. But once again, it is going to be inconsistent across the country because it's going to be commissioned through local authority.
Well, as I said, 2002, I was working on 2003.
Yeah.
So that's like 17 years. It was ready in 2009.
But don't you think that relates back to our attitude to the homophobia? Because otherwise you could say that well-known recreational party drug, the contraceptive pill for women, you know, you think of the number of unplanned, unwanted pregnancies and terminations that could have been prevented. You know what I mean? It's crazy, isn't it?
And it's an appalling level of almost internalized homophobia, because there
Yeah.
were quite a lot of
Yeah.
gay men on that committee that I was working with for the drug company that shall remain named, who were, well, we don't want to upset, we don't want to upset the horses, let's keep quiet and sit in our own boxes and not develop it. And a appalling attitude that hopefully, thankfully those of us who shouted loudest got our way.
And yeah, like you said, there was Makinder, there was a lot of dragging of feet when it came to the rollout of PrEP, and we're now seeing it in England. 11.2 million, I believe, has been given to roll out PrEP. In Scotland, it's been available for a couple of years. Correct me if I'm wrong on that. But just sort of how it sort of leads me to one of the final points, actually, is the HIV Commission aims to end new HIV transmissions and HIV attributed deaths in England by 2030. How do we think this can be achieved? Obviously, it's a very big question, and we've talked about PrEP and the impact PrEP can have. Donna, maybe if we start with you as someone who works within the NHS, sort of how important has PrEP been, and the role it will play in achieving that goal?
I don't think we can measure yet the effect, but I mean, it's obvious it's going to have a positive effect. It's a really good thing. For this sort of stopping transmission, ending transmission and death. I mean, the only way forward that I can see, we can do all the testing, easy access to testing, good results, early diagnosis, effective part notification, prompt treatment, and people taking the treatment so they're virally suppressed. We've got to understand more about why people don't engage, why they don't take the treatment. We bandy about the word stigma like we have done for the past 30 years. And I think this is the big key, really. We've got to really do some work on that, which starts with Makinder, like going into schools, the education, the next generations coming through, are more open-minded and understanding. I'm wondering if whether things like COVID, this pandemic will make people more health aware, more aware of how their behaviours affect the people, health as a commodity. But yeah, PrEP's got an enormous role to play in that, out of all the other things I've just mentioned. Yeah, it's going to be interesting to see where we go, but I think stigma is the key thing that we've got to really understand a bit better.
Yeah. Juliet, you work in Leicester Sexual Health. How do you sort of see this goal, this target by 2030?
Okay, I think I will speak from my Leicester sexual health background, but also from the many years working in the volunteer sector. One of the reasons why people were dying and are being affected in various ways and so on is the impact of the stigma, the isolation, the exclusion, the rejection. We need organizations like Trade to be there. It gives hope, because the vision is not only for those we are preventing from, but also for those who are living with and affected by. So that gives hope. And secondly, PrEP, the availability of PrEP is key. It is vital that we have that rolled out so that people can access it, but that not in isolation, alongside education. We need to keep talking and keep talking and talking and sharing those experiences, taking the information wherever people are, whoever they are, wherever they are. It is everyone's business. Health is everyone's business. And we need to keep on with that, and hopefully projects like that are supported so that we keep on with that. Now, for me, coming from my own place of work, which is key to taking out information as well as testing, into the community, right at the doorstep where people are. Because it's not everyone who feels it easy to come out to us. For some people, they don't even know where us is. So taking that information out into the community, we need events and so on. We need things like a pride, we need things like the carnival, we need all of those kind of events where people gather and where we can take the test to people and where people can have the access to get tested. For me, that is quite important. But working in collaboration, working together, standing up together for a good cause, I think that is vital, because that is what shamed the attitude where, that shamed the easy option of labeling and blaming and not in my backyard, which I mentioned. That did not help. It didn't yield anything, actually. I think we've come this long way to realize that that is not what helped. What helped was people, you, me, all of us coming together, using the different skills, the different experiences, the different giftings, wherever we are, to support the cause, to enable people, to empower people, and to give hope.
And Ken, as you know, you spoke about sort of your memories from the 80s, and I just wonder, sort of thinking back to then, at this time, with the advances in medicine that are available, you know, could you have imagined it back then, and how do you see it in another 10 years' time for this 2030 target?
I honestly don't, because I think you can't really describe the despair that we were all in, because this was world ending. You weren't going to make it. There was going to be no more of our community left. So by the time, you know, we got to the 90s and drugs started to make the change, I don't think I could have imagined it in the 80s. By the 90s, it started to seem like a dream that was possible to happen. I mean, and from where I am now, I think the important thing is we've got the tools to make these things happen in 10 years' time. You know, we've got PrEP, we've got an array of medications that will suit everybody, you know, because everybody's got a slightly different sort of tolerability to medicines, but you know, there's such a wide range. There is a good, and there's more and more coming. So we have got the tools. I think the actual industry side of it's there. It's now, it's the people side. It's what both of my colleagues have said. It's what's going to make the difference. It's not going to happen if we just sit back and go, oh, well, we've got PrEP, we've got decent drugs, we can test, and just leave it at that. There's got to be an active coming together of everybody to actually push for this to happen, because if we want it to happen, we have got the ability to make it happen. It will not happen if we can't be bothered. And that's, I think, the major thing. And I think, you know, sort of echoing the thing, I would hope that something that comes out of COVID is that we actually have seen people realize that we all collectively run a risk of being ill, you know, having a serious illness. You know, in the past, you know, HIV was seen very, very much as a niche disease. It happened to gay men, it happened to BAME populations, and neither of them were the mainstream white Anglo-Saxon Protestant Brit sort of thing. That ain't the truth anymore. There's a disease out there that can actually just go, you know, can randomly pick out people. I think that hopefully, you know, we have got the, you know, the mask deniers and all the rest of the idiots, but hopefully most people have seen that disease can affect anybody. And hopefully that's the sort of emphasis that we can pick up on that, and we can actually leverage to our own advantage to make this happen, is because we can say, look, you know, we can get rid of COVID, we can get rid of HIV, we can get rid of other diseases. and sort of push forward to that. So I think technically we can do it. It's whether or not we want to do it, and whether or not we have got the will to do it. I think is the key.
I mean, I've also got a different perspective as well, because with the new work that trade are embarking on with new arrivals, actually it's understanding that as a global community, as individuals, we're transient people now. People are traveling a lot more. There's more people, you know, moving into different countries. And as we work with refugee and asylum seekers, it's about not, even though we have the tools and the knowledge to then share, but actually we need to understand more about people. We need to understand more about different communities, and about an understanding that actually with the knowledge and education approach, it can't just be from somebody who's been through the British schooling system. It has to be for individuals who have moved to a new country, leaving, and in the case of refugee and asylum seekers, maybe leaving behind lots of stigma, discrimination from their countries of birth, and actually understanding the traumas that they may have experienced there, and how that also shapes and impacts on taking on that knowledge, taking on this education and empowering individuals to access the services which they have every right to access. You know, even people who are refugee and asylum seekers still have access to HIV treatment. And also getting people to understand that if you do have a HIV diagnosis from your country of birth and moving to the UK, you have every right to access that HIV medication when you get here. And it's really important to get that message out there, because I feel that a lot, especially with refugee and asylum seekers still being stigmatized and not feeling that they have any right to access that medication, they do when it comes to HIV medication.
And also we see the medication as being so liberating and everything, which it is, because some of these people that I've seen coming from abroad, they're taking the medication, but they're still frightened to touch their children, prepare food. So their lives are altered in this, you know, overwhelming, dramatic way, needlessly. So it's trying to impart that information to them. I mean, education,
Yeah, education, but also the language that we use too, because I mean, a lot of literature out there is in English, and as more diverse communities start to, you know, come into Leicester and Leicestershire, you know, Leicester has such an amazing diverse population, but actually is that reflective in the resources that we provide for individuals? Is it reflected in the outreach that we provide? No, it's not. And actually this is where we need to learn to not try to push our model into those communities. We need to go into the communities and learn from them. We need to talk their language. We need to understand what is happening on the ground in their communities in order for us to be working more effectively, like Juliet has said as well, in partnership, in solidarity. And actually, we're not trying to enforce something onto them. We want to have communities involved with us from the onset to ensure that actually the messaging that we want to get out there is effective and actually will be beneficial to all people. So actually, it might be a case of with some communities, we might just take 2 steps back from the progress that we've made, just so we can actually get everybody to that same level of education and knowledge, and empowering individuals that there is no shame to getting tested, there is no shame to accessing treatment, there is no shame to have the sex that you want to have, but actually how can we then protect individuals but also the wider community whilst doing that? And I think that's for me, in order to get to 2030, we need to be learning more about different communities and getting them involved from the onset, but also making sure that within research, within monitoring, within data, that their demographics are represented. And I think that's always been one downfall of NHS demographics. They're very limited when it comes to things like ethnicity. If you're not exactly sure what the exact ethnicity is of an individual, but you're seeing an increase in individuals from, you know, a particular ethnic background coming through as HIV positive or to clinic, or they're not coming through to clinic, something's not happening. And actually, when it comes to data, if that's not reflected somewhere else, then funded work like we do here at Trade won't happen. So actually, you know, it's really important to ensure that we're collecting the data of the diverse communities to ensure that they are represented throughout.
And Juliet, your work exists in that sort of outreach capacity within Leicester. How important is it as we sort of drive towards this 2030 target that, like Makinder says, the right resources are put in place to reach different communities and to engage different communities, and we don't just sort of blindly drive toward this target whilst leaving different people behind?
I think one of the key approach has been volunteering, look into getting volunteers from the diverse population from the different places where they are actually covering the population, the diverse population in Leicester. So people come from those communities, or we reach out to the people in those communities, have people from those communities work with us closely to take the messages back into the communities, to offer those services into the community. For us, I think it's something that Makinder and I have spoken about a lot, is how to involve them through volunteering. But there is also the C card idea, which is rolled out by Leicester Sexual Health, the prevention team. It's another good one where people can be able to access free condoms from at any community or school, is it, which is signed up with the C-card scheme, any pharmacy that they sign on. That again empowers. For me, I see it as a kind of empowerment. So people have the power to be able to make those decisions, and all what people need is just to sign on, and they have that access. But like we said again, when it comes to communities where people don't even know about those things, or communities that don't even understand how that works, or whose understanding of services is different. Like we could take the example of the refugee and asylum, the scheme that Makinder and Trade are working on. People are new, they need a contact point. They need someone who is there for them, with them, along those journeys, to empower them to be able to access these things. So again, having people, working with people, and with in partnership with other organizations and communities is a key to reaching that target.
It's what we always say as well. Sorry, before you go, Donna. It's what we always say is communities aren't hard to reach. Your service is not accessible for them, and this is the one thing we always try to drive home. So don't expect people to come to you, because you need to go out to them, rightly so, but also make your service accessible for them instead of putting them as a group of hard to reach people.
I was also just thinking about the people who you were just talking about. When we are lucky enough to get them into the service, they often have a lot of other complex health needs because of the inadequate healthcare they've experienced. So HIV sometimes, unless it's a late diagnosis, HIV is just a small part of, what else is going on for them. So it's just so important, because often, or if they're ill with HIV and that's how they get diagnosed, that's brought them into the healthcare system, and other things are detected,
And also understanding that relationship between mental health and HIV. And I think that's another thing as well, where, especially when people come with complex health needs, if we're talking about refugee and asylum seekers who may be experiencing mental health issues, and then on top of it, HIV diagnosis, actually, trying to balance that support for the individual to access both, but one could be cancelling out the other. So somebody may not want to maybe feel that they can't access HIV support because of their mental health issues, or likewise the other way around. So finding that balance to ensuring that that holistic support is available for everyone.
Yeah, I mean, just adding on to what you both said, for me, that is why I mentioned the need to have organizations like Trade, because it could be a contact point for many, not just coming in, but meeting people who have the understanding, who have, through the years, developed that deep level of experience and compassion to be able to journey with people on this journey from the start. But sometimes it's a journey where you go forward and come backwards, because something can knock you down, and you need someone. I don't know. It's something that we, not just us, but I'm hoping that the authorities would reflect on this and see the need. We reflect on this or see the need, because for me, it's not enough to have the assumption that because treatment is effective, so everybody's okay.
Well, human beings are more complex. It's
Yeah,
not, a person isn't just a HIV diagnosis, are they?
Yes,
You know,
yeah.
They're
So
an individual with lots of different needs, lots of different issues.
Yeah, and people actually need that contact point, that unique selling point where they can engage from that point of view. From that point of view, there are many different services and so on which deal with many different other aspects. But the situation of HIV becomes more complicated in the sense that from the start, a kind of box had been created. That labeling, that stigma that had been created is what is still hanging on and still having its grip on a lot of people and on the community, whether with testing, whether with living, or treatment and so on. So that issue of treatment, stigma makes it important for us. If we're ending it in the next 10 years, we need to start thinking of having organizations like that are working with people to end it that 10 years, not just in the air.
Absolutely, absolutely. And I think we'll get those resources and links out in the rest of our events for the day, for World AIDS Day. So those resources are available if people want to access them. That brings us to the end of today's discussion. Thank you to our guests, Makinder Chahal, Juliet, Kisob, Donna, Rees, and Coney. Thank you all for joining me. It's been brilliant. If you want to share this discussion online or get involved in the rest of the World AIDS Day events, you can use the hashtag Leicester WAD 2020. And for more information about TRADE, you can visit www.tradesexualhealth.com, where we'll have links to all the other resources as well. Thanks to my guests again, and thank you for watching. Take care.
Thank you. All right.
Bye.